No, this is the non-surgical part of the program, and a very important part, as Dr. Talbot said. Making a diastasis small not only helps back, GI, pelvic floor, and postural problems, but it also helps prevent a C-section, and it helps prevent an incisional hernia. Making a diastasis recti small before abdominal surgery, especially an umbilical hernia where it's open above and below, will help it stay in place better. But making the diastasis smaller with the Tupler Technique exercise program will make the connective tissue stronger and will also make the abdominal muscles stronger. This is really important to have stronger connective tissue because it's easier to sew. And with the abdominal muscles, it's much better because in the recovery process, the patient will be able to use them and maintain the integrity of the sutures. The incisional hernia is basically caused by intra-abdominal force on the abdominal wall and on the stitches. All right? So, my feeling is that you should eliminate the force. I tell my clients the force be without you. And what they need to do with this program is strengthen the muscles and know how to use them in the recovery process. In any type of surgery, whether you had shoulder surgery or you had knee surgery, you prepare for it with physical therapy. But for some reason, you're not preparing, your patients aren't preparing for this surgery. And my feeling is that if they're going to maintain the integrity of the sutures, it's very important for them to prepare for this surgery. Now, if they prepared 6 weeks, that would be the best. But if they do it at least 2 weeks, that will be beneficial also. And if you tell your patients, listen, I'm going to do this surgery, but you are responsible for maintaining the integrity of the sutures. You need to strengthen your muscles and learn how to use your muscles in the recovery process. So when they're recovering, what are they doing? All right? They're getting in and out of bed right away, and that's a tremendous amount of force on the stitches. They're sitting up from a chair. They're going from a seated to standing position, and I'm sure you tell your patients, listen, don't lift anything heavy over 5 pounds after the surgery. But if they go from a seated to a standing position, what are they doing? They're lifting their whole body weight, all right? If they have strengthened the muscles before the surgery, then they're going to be able to have an awareness of how to use their abdominals to engage the transverse and get up and down correctly, how to go to the bathroom correctly, when they sneeze, when they cough. They are responsible for eliminating the force and maintaining the integrity of the sutures. I've been doing this program since 1990. I initially worked with pregnant women, and one of the physical therapists, we would do the program over 6 weeks, and we would check for the diastasis in week 1 and week 6. And one of the physical therapists that was teaching the program for me said, I've never seen a diastasis get smaller as the belly's getting bigger. She said, you need to get research on this. So I contacted Columbia University, program in physical therapy, and they did the research, and they had they studied the people that, and this research is up on my website, so you can look at it at diastasisrehab.com or tuplertechnique.com. And the study shows that the people that did the Tupler Technique had a smaller diastasis than the people that didn't. Then there was that other study that you saw that said that there was really no effect. And Cynthia Sciarella from Columbia said that the difference was that the people in the Tupler Technique program had approximated the muscles and did the transverse exercises. So I'm going to go through the program with you so that you can see what it is. But I also have statistics on my website of my clients and the licensees of people that are doing the program all over the world. We now have 31 licensees teaching the program. I'm now training a physician's assistant for a plastic surgeon who did the program because she wants all her patients having breast reconstruction, and she takes the fat out of the abdomen, so she wants all her patients to be doing this program before the surgery. So basically, with my statistics, I have 1,200 clients, and we're actually going to be updating it because we have about 2,000 now. But in the study that's on my website, the statistics on my website now, you will see 1,200. And what it shows, I'm just going to sum it up, but you can look at all of it because it shows distance, it shows condition of connective tissue, it shows circumference of the body, it shows all of that. And we show it over 18 weeks. We check week 1, week 3, week 6, and then again in week 18. And the bottom line, which was very significant, was that in the first 6 weeks, we can make a diastasis 55% smaller. And you can see all my before and after pictures of both men and women on my site, and that's all there. I figured I would spend the time teaching you more about the program. So my program is all about healing connective tissue, and I do this 3 ways. I do this by approximating the recti muscles with the Diastasis Rehab splint. I'm going to put this on and show you in a moment. Is the microphone on?
Okay.
Is this one? Oh, okay, thank you. When you look at the muscles, the recti muscles, under ultrasound, and they're here, and you engage the transverse, the muscles go sideways, and what it's doing is stretching the already stretched out connective tissue. So it's very important to approximate the muscles so they move in the right direction, backwards, instead of sideways. All right, so what we're doing with the splint is approximating the muscles and the connective tissue. So you know that the connective tissue, as everybody has said, is stretched out. So what I'm wanting to do is take the stretch off the connective tissue and continuously keep it in this narrow position. Then when you do the exercises, it's bringing blood flow to the connective tissue. So we're strengthening transverse to bring blood flow, strengthening transverse so that your patients can use these muscles, are strong enough to use these muscles in the recovery process when they're standing up, when they're sitting down, when they are getting in and out of bed, when they're having a bowel movement. These are all very forward, forceful movements that it's very important that the patient brings it back, all right, away from the stitches in the connective tissue. And we're also protecting the connective tissue, all right, protecting the connective tissue from getting stretched, all right. So that's why we want to have them use the abdominal muscles with activities of daily living. For the first 6 weeks of the program, we don't have them do any exercise routines or go to any exercise class. All we want them to do is cardio. They can go on a treadmill, they can walk, they can go on an elliptical machine, but we want them to wait until week 6 to start exercising, because we want them to be able to incorporate their strengthened transverse muscle into the exercise routine. All right? Before 6 weeks, we don't feel that the muscle is going to be strong enough to do this, and we want them to be able to modify the routine so it's diastasis safe. All right? So in terms of protecting the connective tissue, what am I talking about? I'm protecting it from getting stretched. So we don't want them to do any exercises where they're flaring the ribs. Okay? So all the yoga stuff with breathing to the sun, where they're doing all of this, we don't want them to do that. As a matter of fact, when we're doing the exercises, we want them to take the ribs and move them together. All right? Taking the stretch off the connective tissue. Okay? We don't want them to do any crunches, right? Because with a crunch, it's physically impossible when the shoulders come off the floor to engage the transverse abdominal muscle. We don't want them to do any crossover exercises, right? And this was mentioned earlier, because taking the obliques, it's a shearing movement. So when you see people in the gym doing the exercise with the legs up in the air and going like this, that's a double whammy, because the shoulders are off the floor, so they're not able to engage transverse, and it's a shearing movement, so we don't want them to do any of that. There's always a modification if you want to work obliques. All right, we don't want them to do any hands and knees exercises because all the weight of the organs goes on the connective tissue. All right, so I'm going to show you two things.
You have a minute left.
I have a minute left. Okay, that's good. So this is the splint. Okay, and there's, this is the original splint, and then we have one for short torso people, and then we also have extenders that during pregnancy can be worn. So it crosses over like this. Normally I do it in front of the mirror so I can see what I'm doing. Knees are bent, transverse is in. This is the most important part, is moving the muscle to the middle. I hold it here, and then I attach it on the side up on top. I bring it down. Again, I'm moving the muscle to the middle. And then I attach it on top here. And then on the bottom, I move it here and attach it here. Okay? So this is the splint. The program is 4 steps. The 3 exercises, 2 seated, 1 back lying. It's called a head lift. Wearing the splint, engaging the transverse with activities of daily living, and getting up and down correctly. If you want more information, you can come to my booth 27 or look at my website. Thank you.
Thank you very much.